This is an analysis for the INOV ROADFLY MAX running shoe. We utilize our structural parameter testing data, our mathematical model, clinical observations, and knowledge for the method of injuries to analyze our shoes. So the first thing we're going to do is we're going to take our shoe and we're going to place it on our testing apparatus, which will test for midfoot stability, hindfoot stability, vertical support, energy return, and cushioning. Once we get that data, it's placed into our mathematical model. And then from there, we interpret what the abilities of the shoe is. So we do two tests. We test the shoe without its insole, and we test it with its insole. Without its insole, we get a potential shoe stability index of 33.73. Testing it with the insole, we get a shoe stability index of 19.33. So with the insole, the shoe lost 42.69% of its potential stability. That is a very poor insole translation. So let's take a look at the shoe being tested with its insole. It weighed in at 9.4 ounces. It tested to have minimal midfoot stability with a torsional control index of 34 inch-pounds. It had minimal hindfoot stability with a vertical compression index of 10.5. What that means is the shoe was very soft under the heel. In the midsole, and that creates a unstable hindfoot. The next thing we test for is for its vertical support, and this shoe had a negative vertical support with a minus 4.5 millimeter loaded heel to toe drop. And what that means is when the shoe was loaded at the heel, it dropped 4.5 millimeters, and this creates a lot of tension on the posterior calf complex. So the next thing we test for is for the shoe's performance, and we grade the shoe performance by its weight and energy return. This shoe had weighed 9.4 ounces, and it had a high energy return of 26.24 millimeter, a rebound index of 26.24 millimeters. With those parameters, we would put it into the medium fast plus category. We grade our shoes as slow, medium fast, fast, and ultra fast. Now, the other thing is that because the shoe has minimal hindfoot stability and negative vertical support, we do not recommend the shoe for those that have lower extremity and posterior calf complex related issues. And that would include tight and painful calves, heel pain, Achilles tendonitis, runner's knees, and iliotibial band pain. So taking all of this data together, who would best benefit from the shoe? Well, we think from our clinical observations and our knowledge for the mechanics of injuries, that this shoe would be better utilized by neutral to mild pronators of light stature, void of lower extremity and posterior calf complex related issues.